Hi everyone. As you guys might have figured out by now, it's Nishida. And my cancer project part 2 is about non-Hodgkin's lymphoma. Alright, so to start out, what's non-Hodgkin's lymphoma, or NHL? You people remember the lymphatic system? So the lymphatic system is part of the immune system. It has lymph vessels, similar to blood vessels, but they carry lymph instead. Lymph is a clear fluid that contains white blood cells, mainly the lymphocytes T and B cells. Lymph nodes store WBCs and trap and remove bacteria. Tonsils, thymus, spleen, and other tissues of the stomach, skin, and small intestine are part of the lymphatic system. This is why lymphoma can start anywhere, but it usually starts at the lymph nodes. I'm pretty sure you've heard of Hodgkin's lymphoma, so what's the difference? Hodgkin's and non-Hodgkin's are diagnosed in a similar way. Tissues are looked in a biopsy. However, if an abnormal red blood cell, called a Reed-Sternberg cell, is present, the patient has Hodgkin's lymphoma. If it's not, it's NHL. Non-Hodgkin's patient survival rate after 5 years is about 70%. There are about 71,000 new cases of NHL expected by the end of this year, out of which about 19,000 deaths are expected. Their survival data is divided into stages of NHL. There are 4 stages: localized, regional, distant, and unstaged. The survival rate is as listed below. Non-Hodgkin's is the 8th leading cause of cancer death in the U.S. However, each year, the survival rate increases by about 3%, and cases also increase by about 0.5% each year. Traditional treatment for NHL used to just include chemotherapy and radiation. However, some newer methods are now being used, often as complements or different treatment altogether. This includes targeted therapy, which just targets cancer cells, and biologic therapy, using the patient's own immune system against cancer. Alternate treatments include high-dose chemotherapy with stem cell transplant. The chemo kills the cancer cells, and stem cell transplant refills the lost blood cells, basically. Vaccine therapy, which kills cancer cells instead of trying to prevent it like normal ones. And clinical trial treatments like using high doses of fluorodeoxyglucose, or FDG, and using kinase inhibitors. Chemo uses drugs that has bad side effects, like damages the heart, lungs, and kidney failure. Radiation uses high energy rays that can cause low blood count and cause the patient to bleed easily. FDG mimics glucose and enters the glycolytic cycle. However, it cannot be metabolized, and this could pose some risk in normal cells. Kinase inhibitors interfere with the B-cell receptor pathways and can cause inflamed hair follicles and photosensitivity. Chemotherapy and radiation stop cancer cell growth and proliferation. Kinase inhibitors and FDG stop cancer cell proliferation and growth, respectively. All 4 treatments are short-acting, needing re-administration or large doses. Traditional treatment and alternate treatment are changing every day. Targeted therapy now includes monoclonal antibodies that are genetically engineered to attack T cells or B cells based on the surface proteins present. Although this is part of new research, rituximab, an approved immunotoxin poison to cancer cells, is already being administered for short time periods to help suppress the lymphoma. An immunotoxin being studied is UCHT1 fusion protein. It targets the malignant T cells with a specific surface protein. It has addressed 99% of the cancerous T cells within 6 months to 2 years of being administered to some patients. Another clinical trial includes an immunomodulator, lenalidomide, that interferes with the blood vessels involved in tumor growth and restores immune cells to kill tumor cells, thereby reducing and preventing tumor growth. If lenalidomide and rituximab are used together, the patient's cancer may be suppressed and their immune system might be restored. Other treatments that may be the hope for the future is autologous hematopoietic stem cell transplant, or using stem cells of the patient and replacing them back in them. Although it can also reintroduce lymphoma cells to the patient, current research is trying to resolve these problems. Also, genetics is being pursued to resolve lymphoma. A clinical trial for a lymphoma vaccine is going on. BioVax-ID uses the genetic makeup of B-cell antibodies to create a vaccine to suppress the targeted B cells. Well, that's the end of my part 2 presentation. Hope you guys liked it.